Which osteosarcoma types are hard to treat? Imagine facing a battle where not just the type of enemy matters, but how it fights back. That's often the case with osteosarcoma, the most common primary bone cancer, especially in young people. While there are different subtypes, the real challenge isn't just what they look like under a microscope but how they respond to treatment. The main hurdle in treating osteosarcoma is resistance to chemotherapy, which can develop in any subtype. This resistance makes tumors harder to shrink and increases the risk of recurrence. Most patients receive a combination of drugs like methotrexate, doxorubicin, cisplatin, and ifosfamide. But sometimes, the tumor cells adapt, becoming less sensitive to these drugs. This adaptation is a major reason why survival rates haven't improved dramatically over the years. It's not just about the subtype but about how the tumor behaves and reacts to treatment. Tumors that resist chemotherapy tend to have worse outcomes, regardless of their microscopic classification. Certain features make some osteosarcomas especially difficult to treat. If the tumor has spread to the lungs or other parts of the body, it becomes much more challenging to manage. Metastatic disease lowers the chances of successful treatment. Tumors that are large or located in tricky areas like the pelvis or spine also pose significant challenges because surgery becomes more complex, and complete removal is harder. Additionally, tumors that are resistant to chemotherapy due to molecular changes, such as increased ability to repair DNA damage or pump out drugs, tend to be more aggressive and less responsive. High-grade conventional osteosarcoma, which includes osteoblastic, chondroblastic, and fibroblastic types, is the most common and tends to be aggressive. These often requiring intensive treatment. Telangiectatic osteosarcoma, once thought to have a worse prognosis, is now considered treatable with modern chemotherapy and surgery if diagnosed early. Small cell osteosarcoma is quite rare and can sometimes behave more like Ewing sarcoma, which may respond differently to treatment. Surface osteosarcomas, like periosteal and periosteal types, are usually lower grade and tend to have better outcomes, but high-grade surface osteosarcomas are more aggressive and harder to treat. It's important to remember that the overall prognosis depends on many factors. Tumor location, size, whether it has spread, and how well it responds to chemotherapy all play roles. Tumors that respond well to treatment generally have better outcomes. Conversely, those that resist drugs or have spread are more difficult to cure. Ongoing research aims to understand why some tumors resist treatment and how to overcome this resistance. Scientists are exploring targeted therapies and immunotherapies to improve options for these hard-to-treat cases. In the end, the toughest osteosarcomas are those that resist chemotherapy, have metastasized, or are in difficult locations. But every case is unique, and personalized treatment plans are essential. Working closely with a multidisciplinary team helps optimize outcomes. If you or someone you know is dealing with osteosarcoma, it's crucial to follow the guidance of healthcare professionals and stay informed about new advances. Remember, advances in research continue to improve our understanding and treatment of this complex disease, offering hope for better outcomes in the future.